All right, so we're going to be doing a thong lift drawing. Our patient has been so kind to allow us to videotape the process of doing the markings. The first most important step is to talk to the patient about where she wants to place the scar for the lift. The lift is basically meant to get rid of any extra skin that is along the thong or bikini line. Okay, that's a very important concept to know. We are not going to be adding any volume to her buttock. This is not a Brazilian butt lift. This is a thong lift. They're two totally different surgeries. You've seen me talk about that a lot on social media. And so today we're going to focus on pulling up all of the extra skin that she has along that thong line. And in her case, she's going to get an improvement also in the fact that she doesn't want this tattoo anymore. So we're actually going to be able to mark this to remove the tattoo and the extra skin. One of the major benefits is we get to pull up on a lot of the sagging skin from the buttock area, and that's going to create a tighter overall buttock envelope, like a skin envelope is going to be tighter, but it's not going to change her volume. Okay, and I know that a lot of people ask that question repeatedly on social media, like, is it going to change the size of her butt? No, it's not going to change any sort of volume. I'm not taking out volume when I do the procedure. I'm just literally taking out extra skin. That's the only objective with the operation. All right. So now that we kind of have this idea of where we're going to go, I'm going to mark it this way and this way. So I'm just going to pull this here a second. Yeah, that's perfect. It's going to get, the tattoo's going to go for sure. Okay, so now what we're going to do is, in order to assess how much extra skin we're going to be able to remove, I'm going to do a pinch test. And I'm just going to basically simulate taking off as much of the extra skin from back here as possible. And that is what's going to help guide me during the surgery. Now, during surgery, I can pull more skin if I feel like it's safe. Like I can take off more and still close the incision safely. And that's the key to this operation, is really knowing by experience, knowing how much skin you can remove for the patient without overdoing it and then causing a wound healing problem. So we don't want any wound healing problems. We want everything to heal very nicely and come together nicely. And I am going to taper it off on the corners here because we're not going to go all the way around. We are just going to focus today on the posterior aspect. And so in order to avoid any dog ears in the corners, I am going to do a gentle tapering, a gentle ellipse at the end, so that she's not left with anything here that could cause her concern down the line. That's another important tip to this surgery. Now, the great thing is that this is going to hide literally along her bikini line. So you can see I'm marking a lot of skin here between my fingers. Okay, we can measure that for you guys at home if you want to see, I don't know, roughly how many centimeters I'm going to be removing. But it is quite a bit. It's quite a bit. So she will definitely see a nice improvement and pulling up of all of this loose extra skin. All right, so let's take a measurement here. And we're going to also look for symmetry. Symmetry is very important in plastic surgery. You want to have nice lines, smooth lines, thin lines. And what we're going to do is we're going to kind of get an idea of where she is here. So you're looking pretty much at 10 centimeters worth of skin, which is quite a bit of extra skin. And I've been doing this for a while, so my markings are actually spot on. So she's very symmetric. And then the other thing we're going to measure is from the center of the buttock to the outside. We want to make sure that this is equal. on both sides. So she's about 22 over there. And I'm going to extend this one just a couple centimeters, just so it's perfectly matched in distance to both sides. So now she's going to have equal length of the incision and equal width to the incision. So that's going to help a ton to lift up. And then we're just going to use some other colors that I like to use, just so we reorient everything exactly the way that it is now. We're going to put everything back together again. And again, avoiding any type of dog ears or bunching. If you don't know what a dog ear is, it's basically a bunch of skin that kind of comes and creates like a pouch on the corners of your incisions. And that's a no-no in plastic surgery. You have to always work really hard to figure out not to leave any dog ears. So, all right, so that's pretty much the way that I mark thong lifts. And we're gonna go to surgery now.